It's the 15th of the month, and that means our Rally for Red Day this morning. And as always, we partner with Mayo Clinic, and we're trying to give you the tools that you need in order to be heart healthy. Today we're talking about cholesterol medication, and Mayo Clinic cardiologist Dr. Todd Hurst is joining us once again here on Snoring Living Live. It's so good to see you, Dr. Hurst.
Great to be here. Thank you for having me.
I always love it when you come on because you always give us such valuable, useful, and easy to understand information. And we're talking about cholesterol this morning. First of all, explain to us, what do you mean by blood cholesterol?
Well, there are three parts of the cholesterol that we pay the most attention to as doctors: the triglycerides, the HDL, commonly called the good cholesterol, and LDL, the one we really pay the most attention to, or commonly called the bad cholesterol, is what we mean by cholesterol as physicians.
HDL is the bad.
HDL is the good cholesterol, LDL is the bad cholesterol.
I messed it up already. Okay, let's talk about ranges of cholesterol and how you know when high is too high.
Yeah, great question, and one that's not an easy answer because really it depends on your risk. For example, somebody that has a very low risk for heart disease, we can accept a higher cholesterol, whereas somebody that has high risk for heart disease, we want a much lower cholesterol number.
But if you remember a while back, in my case, all of my levels were good. Mine was really just based on hereditary.
Exactly, and that's one of the things that we really...
So numbers aren't always accurate.
Right, and that's one of the misconceptions about cholesterol that maybe can change people's understanding of this, is that we're really not treating the cholesterol, we're treating the risk for heart disease when we prescribe the medications.
Okay, let's talk about folks who should consider going on cholesterol-lowering medications. Who are those people?
Yeah, the American College of Cardiology came out with recent guidelines that suggested that there are 4 categories of people that may consider cholesterol-lowering medications if their doctor thinks it's a good idea. Those that have a family history of early heart disease, those who have a measure of artery disease called a calcium score, a CT scan of the coronary arteries. If they already have evidence of artery disease by narrowing of the arteries of their legs, or if they have a measure of inflammation by a blood test called a C-reactive protein that's elevated, those 4 categories of people may benefit from being on a cholesterol-lowering medication.
And some of those tests, the elevated C, is that something that you need to ask for, or is that something that you would automatically do in assessing a risk?
Yeah, usually it's the doctor's decision to decide if that would add incremental information to their assessment or their recommendations, but certainly have patients that come and ask for those tests.
Oh, okay. Now let's talk about people who really should be on cholesterol-lowering medication. Who are they?
Well, the ones that the least controversial are the ones that already have had heart disease. So if people that have had heart attacks or strokes, stents or bypass surgery, those people have been proven to benefit, to have less risk of future heart disease events if they are on these cholesterol-lowering medications we call statins. Another less controversial group, those with very high LDLs or the bad cholesterols over 190. People with diabetes are at particularly high risk for heart disease, so most of the time we're recommending statin medications for those individuals. And then if we add up their risk factors in a risk score, and that score is high, then we typically recommend statin medications for those people.
You know, and I think a lot of people avoid it because they're afraid of the side effects. When you look at the side effects versus the benefits, what's your recommendation?
Yeah, you know, that's an important decision, and one that I think is best made by the patient and the doctor, because there are risks and benefits to this. On one hand, I don't want anybody to be on a medication that they don't need to take, but on the other, I don't want to miss an opportunity to prevent problems for them in the future.
Right.
The adverse effects of the statin medications are low. They're about 10 or 15% of people have a hard time on these medications, but because they're so commonly prescribed, we all know somebody that's had a hard time on them. So it's a common discussion for me to explain, here's why I think it might be a good idea for you. The patient, though, ultimately has to decide if that makes sense to them.
Communication is the key. Dr. Hurst, thank you so much. Always good information. And of course, for more information on cholesterol lowering medications, you can call the Mayo Clinic at 480-301-6950. And of course, ABC 15 is teaming up with Mayo Clinic for the Rally for Red campaign. Each month, we'll give you tips and tricks to help keep you and your loved ones heart healthy. To learn more and get our Rally for Red reminders, sign up at abc15.com/rallyforred.